Now, a culture of silence has descended on the industrial area of the Asokwa municipality in the Ashanti region. Residents say air pollution from some industries in the area is making their lives a misery, but they have been warned that speaking up may cost them their jobs with government and companies. Love FM's Mona Lisa Frimpong explores the situation.
A solid waste scavenger sits at the Oti landfill site in Kumasi. He worries every day about his exposure to harmful substances from waste materials here. He's asked to keep his name secret for reasons that will soon become obvious. The man in his 30s is frail and sickly. He wears no protective clothing as he sorts out recyclables. The man says he's battling headaches, coughs, difficulty breathing and tiredness. He attributes his poor health to the inhalation of hazardous substances from the solid waste. His last hospital visit revealed a respiratory infection, but he has no money to follow up.
Last year, I'm in hospital. I'm a problem. Because ball and cent, it be too much. Oh, serious, nice. Ball and cent, Also, the morning I could see I'll take ball and cent.
Medical practitioners have advised him to switch to a different job. But the man says with no formal education, this is his only choice for a livelihood. Scavenging is a source of income for unskilled people in most developing countries. A study by the Journal of Environmental and Public Health in South Africa found health complaints and injuries are common, including respiratory infections, headache, diarrhea, and shortness of breath caused by polluting gases like methane and carbon dioxide. But the true extent of problems at the Oti landfill is impossible to assess. In every step of our investigation has been blocked by management. The Oti landfill facility is one of the largest disposal sites, receiving about 1,500 metric tons of garbage every day from Kumasi and its environs. Its location in the community has provided informal jobs for residents in the community, from garbage collection, scrap dealing, and scavenging. We tried to talk with other scavengers at the Oti landfill site, but management of the facility refused us entry. Informal workers inside the facility refused interviews, saying they feared being targeted by the company. But those who did agree to speak off camera revealed headaches and migraines are common. Kwame Lucky did agree to speak on camera. He has pitched camp close to the landfill site. After receiving garbage from the dump site, he airs it for 3 days to reduce the odor before sorting out scraps. Management of the landfill knows about the problems. 2 years ago, the site was redesigned to reduce environmental damage and eliminate hazards that the garbage was bringing to the community. But residents of neighboring communities of Dompase and Oti say the overwhelming smell from the site and their continued poor health shows more needs to be done. Former assembly member of the municipality, Elliot Bano Fusu Jr., agrees.
When it rains, the air that comes from the landfill site into the community is very bad. We don't breathe good air at all, I must be frank. And it's having health effects on the residents. There's a community clinic here. I initiated it as assembly member, that's Lady Julia. The residents always frequent there. The residents have been going there with related problems, health-related problems associated with the, what do you call it, breathing of poor breathing or pollution of the air.
I'm a few meters away from the Oti landfill site, and residents here have complained that the air quality of this area is not so good. This area is part of the Ashanti municipality, which is the industrial hub of the Kumasi metropolis and even the Ashanti region in totality. Researchers from the Kwame Nkrumah University of Science and Technology have conducted a series of research which proves that this place remains one of the most heavily polluted places in the Ashanti region. Healthcare facilities in the area, the Lady Julia Health Center, Kumasi South Hospital and other health facilities refused to comment on the incidents of air pollution-related illnesses in the municipality. Off the record, staff told Love FM they were afraid of being politically targeted for talking to a journalist. But former Assembly member Bano claims that healthcare facilities in the area record high cases of respiratory infections.
Sometimes the air is also polluted as a result of smoke from the landfill site. It is recently that it has calmed down small. Formerly, when they just light, they put fire into the sawdust that they have been bringing to the landfill site. So the atmosphere become dark. Then we breathe in smoke. So it also have effects on us. Talk about complaint. We have been complaining for the past 10 years.
It's not just the waste dump that is causing air pollution and sickness here. On a typical day in the Asukwa municipality, a haze hangs in the air. The municipality is the industrial hub of the Ashanti region with oil, wood and food processing companies situated alongside the Akufo-Addo Company Limited. Before 2020, meat was often roasted over car tires and wood. Butchers burned furs in open fires producing thick black smoke. Butchers reported high rates of respiratory infections. In 2019, then Sanitation Minister Cecilia Abnadapa banned the practice to stop the harmful effect on the health of consumers and residents. Butchers have switched to the use of liquefied petroleum gas to singe the furs.
The time that we were using the tires, even that time the smoke was entering us more. Even sometimes the breathing, or even when you cough, you see the level different from now that we are doing the gas.
First day night, then yet the BIM on your Tambia to when it's a boy.
Tano ukoma unsi ekọ hunu eno waso kwa dwale won yire ho ntwetwe ho yi a aje chabia o yakọ hosia na ni na wo.
While government will not release details of air pollution in the area, a group of scientists and other experts measured the air in October 2023 as part of the Clean Air Summer School held in collaboration between the University of Leeds in the United Kingdom and the Kwame Nkrumah University of Science and Technology in Ghana. Air sensors mounted at the Oti landfill site and the Kumasi abattoir measured air quality over several days. At the landfill site, the air pollution exceeded the World Health Organization's guidelines for what's known as PM 2.5, the most dangerous air particles all day, every day. It also exceeded Ghana's less stringent guidelines for several hours a day. At the abattoir, the sensors found the air was unhealthy for a third of the day. These high levels of air pollution are harming the health of residents, according to medical coordinator for doctors in business organizations and public health consultant, Dr. Florence Buampunsim.
It has to be a consistent exposure to it. So if you have been in a particular area and you've been there and it's constant inhaling of these gases that are emitted, that's when you can have these effects that some of these effects that I'm about to talk about. So there's respiratory issues where you have upper respiratory issues, breathing problems, coughing, you have irritation and things like that. We also have cardiovascular problems, okay, which causes problems for your heart in long term. But all these things I'm talking about is long-term exposure to these gases.
The research team presented these findings to management of both the landfill site and the Kumasi Abattoir Company Limited in October. A month later, the production manager of the Kumasi abattoir, Michael Tongban, denied the research team recorded high levels of air pollution at his facility.
Some people came from KNUST, came and did conduct research on air pollution. It wasn't bad as we are talking about. Understand? And you know, this place is part of industrial area. We are not isolated. There are industries all over here. You understand? So air pollution is minimal here.
Management of the Kumasi Abattoir Company Limited refused to speak on the findings. But days ago, a scientist of the research team revealed the Kumasi Abattoir Company Limited reached out to them privately for a collaboration on how best they can control or prevent air pollution in the facility. In an interview, Municipal Health Director Faustina Osei-Mensah conceded that respiratory infections are second on the list of health issues recorded in the area, but Director Mensah played down the threat from industry. Instead, she blamed cars.
With acute respiratory diseases, we encourage them, if you had infection, just put on your nose masks. And we encourage them to report to the health facilities as soon as they see the signs and symptoms. There are a lot of activities that are going on. And this area being an industrial area, we have a lot of cars that are moving in, out. The whole place is choked. Human traffic is also going on, and vehicular traffic is also going on. So a lot of activities are going on, especially with cars. People are using cars, and the fumes from their engines are spreading all over. That they are all giving us infection. And if you look at the factories, we have factories, and the activities that are going on in the factory, we visit them, advise them concerning their burning of their waste.
But now, the municipality has been found to have high levels of air pollution. Director Mensah said the government is embarking on sensitization programs to combat human activities which contribute to air pollution. In the meantime, Dr. Florence Bwampunsim advises workers and residents in light industrial areas like the Asokwa municipality to protect themselves.
And most of the time, those who are even working directly with these machines are in protective garments. But I'm even going as far as people who live by these machines, because sometimes you feel like you live by it, so you don't necessarily have to, you don't live it, but you are inhaling it, do you get it? So I would advise people who actually live by big industrial areas, big industrial machines, to make sure they wear their nose masks consistently.
This story was a collaboration with New Narratives with funding from the Clean Air Fund. The funder had no say in the story's contents. For Joy News, Mona Lisa Frimpong reporting.